Welcome to PCR London 2024. I'm Karen Wilson and I'm a nurse consultant at St Thomas's Hospital here in London. I'm here today with my friend and colleague Lynne Hinterbuchner, who's a lecturer in nursing colleges in Upper Austria.
Hi Karen.
So Lynne, we're here to discuss patient selection in terms of frailty and cognitive impairment. We had a really good session at London Valves 2024 about this. And do you want to tell me some of the important aspects that we talked about?
Yeah, first I'd like to start with that there's a very strong relationship between physical frailty and cognitive impairment. And I think we really need to make sure that we're assessing the patients for cognitive function and not just frailty.
So you say assessing, but do we need to do any screening before assessment?
Good thing you asked me that, because there is a difference between screening and assessment. Frailty, we use the screening tools, the Edmonton, Rockwood, or the Frail scale. These are the three that are validated for this population and they're easy to use. Everybody has their favorite, so I can't say one or the other is better or worse. They're all good for what they need to do, but they screen.
Okay, so we've screened a patient and then you maybe got some concerns that there may be a problem with either cognition and frailty. What do you do next?
That's a good question. It's different everywhere. Some people are more lucky, as yourself. You have a geriatric team on your service where you can send them to them. But we have just done screening, and I think that's something everybody needs to know. These tools are just screening to do an actual physical assessment with all three phenotypes that are recommended from Freed. You need to do a little bit more: hand grip, walking, getting out of the chair, etc., depending on what you use. So this needs to be done by a professional that's trained and able to do that. So you need somebody to refer these patients to, suggested as a geriatric practitioner or a nurse.
So we've assessed a patient, they're frail or they've got cognitive impairment, and is it important therefore then to be doing some things to put actions in place before we start considering the TAVI?
It's a really good question. We'd like to do that. I don't think it's done enough. We do all of these screenings and assessments, and then we have that information, which you then should bring to an MDT, which you do to make your decision whether a patient is good or not for okay for a TAVI. But I don't think we're doing enough of prehab, so to say. Mm-hmm.
So we've assessed a patient and we know that they're frail or cognitive, and then I think it's important that we bring a patient back to the MDT to discuss whether they're suitable for TAVI. So I'm just going to sum up. So I think we've discussed that screening is important, assessing is very important, but then we actually need to implement some actions to see if we can improve the patient's baseline before we move on to the TAVI, to hopefully help the patient have a better outcome.
Thank you, Karen. Absolutely correct. Make sure everybody's doing screening. I think we heard at our session that not everybody's doing it. So key message, do the screening.
Thank you for joining me today, Lynne.
Thank you so much for having me, Karen.